Hi, good afternoon everyone. Let me share with you what did I study for the CELBAN exam here in Canada. It is simply means it's Canadian English Language Benchmark Assessment for Nurses, and it is an assessment tool designed to assess the English language proficiency of international educated nurses who are trying to apply the nursing profession here in Canada. Let me share with you some of the tips. How did I study for the CELBAN? So we know that CELBAN, it's just like there are similarities with the IELTS. There are speaking, reading, writing, and listening. And the most difficult part for passing this exam is listening, because you have to have at least 10, the 10 or the highest score is 10 is listening. And by the way, I have to share with you what are the tips. So first, I'm not sure what kind of exam is this. So what I did research, and I joined myself in a group called Pinoy IEN, because it's a group where they can share their insights on how they became a nurse here in Canada. And that's why this is what I gathered, and I have researched, and I also look online, some of the topics that I'm not familiar with, and I put on Google about what is CELBAN is, and I also watch on YouTube what is CELBAN. You can view on YouTube by Harpit Brat. She can just explain to you the format of that. Okay, so what I did, you have to research. That is number one. And once you already gathered or research about the what is CELBAN, you have number two. You have to familiarize the format, because IELTS and CELBAN they are really different from each other. But for me, based on my experience, CELBAN is more easy than IELTS, because I don't like IELTS because you have to have at least 7 of score, and IELTS, you have to take the IELTS academic instead of IELTS general. So that's it. And number 3, you have to practice. Practice means you have to speak, you have to listen, you have to write, you have to read. So all of those I did for about 3 to 6 months. And for practice, what I did, I strictly don't watch any teleserye or Tagalog or Filipino movies, because I just want to train my ears to get use of the language, because English is not our mother tongue. And it's very beneficial, because I'm here in Canada. I tried, and I practice with my Canadian friends, and then they also correct my grammar as well. But don't get big deal if you got wrong grammar, because this is how you correct by yourself. Yeah. And what else? So when I was talking to my family, I talk them in English. I know my English is not that good enough, but I know that I can pass the CELBAN, because I practice for about 3 to 6 months. Next is that I practice my grammar every day. So I really go to basic, from the tenses. You have to be good in your grammar, because you have also to become fluent. Even if you are wrong grammar, they couldn't notice that you have wrong grammar, but as long as you have the confidence that you can show to them that oh, you can really show to them that you are really be a good nurse someday if you have a good communication therapeutic technique. And that's it. And number 4 is that you have to know about your nursing background or nursing knowledge. There are some cases when the proctor asked me about what you could do if you could convince your patient to stop smoking, simply like that. And I told so I have to use my therapeutic communication. I have to gain the trust of the patient first, and then once I gain the trust of the patient, I have to move on. I have to tell him, her about what to do next. And then I also connect the patient to the family. And that's the part of the how to convince the patient. Okay, so for studying for 3 to 6 months, I studied for there's no specific time actually. Like I studied for writing for about a month, and then I studied for listening. I focus more on my weakness, which is listening, because I'm really deaf, and sometimes they are so fast, especially in listening exam in CELBAN. The video and the audio were very fast. You couldn't notice, oh, where my answer, and you have only 4 choices in the multiple choice exam. And while you are doing the exam, you could feel like you are nervous, but just believe in yourself that you can do it. Okay, and then what else? You have to make short notes of the diseases. It doesn't mean you can go through the very deep topic of nursing, all about the disease. Like for example, you know about healthy lifestyle, you know about cancer, or about the trending topic that you know of. Yeah. And lastly, be confident and do not get nervous, because if they see how you can deliver yourself, and they could mark you on, this candidate is really good, even though he or she had many wrong grammar, but she did her best to try to pass the exam, like that. And most of all, you have to pray, trust, and believe that you can do everything to become a nurse here in Canada. Thank you for listening, and may God bless us you all. If you have any questions regarding on how to pass the exam, okay, don't hesitate to comment, like, and share, and subscribe to my channel. Thank you, and have a great day. Okay, see you. Bye.